Holy moly, if you were tuned into the hair loss world recently and you were following every media publication that popped up in your face, you would think that we have solved hair loss and we have done it in over a 20-day time span. Well, the National University of Taiwan have been investigating the impact of topical fatty acid serums on the hair follicle and being able to restore hair follicles from their dormant state. What is fact? What is fiction? Is this an example of media hype and hyperbole, or have we actually discovered a hair hack that might be of some substance? Well, if we haven't already connected, I'm Dr. Jonathan Hopkirk, Sydney-based hair loss doctor and founder of Levels of View, an Australian-based hair restoration company that treats people with hair loss on a daily basis. And I've also gone for a hair loss journey myself for the last 10 years, so I'm very passionate about bringing you new insights into what is evolving in the hair loss space. So in today's video, I'm going to discuss the new and exciting prospect of using monounsaturated fatty acids topically to be able to address hair loss and not address it in a way that addresses hormone pathways or addresses the beta-catenin pathways or addresses pathways like the prostaglandin pathways. This is an entirely new prospect and it addresses cellular metabolism. So let's jump into it. So what have these scientists, these researchers at the University of Taiwan, at the National University of Taiwan, been investigating? Well, what I think is really, really fascinating is why they started investigating it in the first place. And you listen to the medical director of the scientific group talk. They were saying that they are intrigued by the fact that when you have a plaster of Paris on your arm with a broken arm, when you take that plaster of Paris off, because of the irritation, you often see improved hair growth in that area. And I, having broken my arm before, I do remember distinctly taking it off and being like, I've got a werewolf arm compared to the other arm. Now, I was about 8 at the time, so I didn't jump into scientific mode, but I did, on reflection, think that is quite interesting, yeah. So this is one of the reasons that prompted this group of scientists to look into how either irritation or irritation-based treatments and other treatments that center around fatty acid absorption into their epithelial hair follicle stem cells could restore hair. Now, if you look at this diagram here, it is known that fat cells have a very important role to play with respect to stem cells, and they have a very important influence on hair follicles. Now, it has been discussed by other hair loss researchers and doctors that the fat cell, the fat lobules around a follicle are really, really important in being preserved when you perform a hair transplant, because those fat cells are what continue to nurture and influence and communicate to their follicle after it has been transplanted. So much so that it's deemed to be a bit of a theory that if you don't have enough fat surrounding that follicle, well, then you get something called recipient site synchronization, in which that hair follicle actually can start to be influenced by those non-DHT immune follicles sitting around it in the recipient site. So it's a very, very interesting prospect, and it's very, very interesting to think just how much fat cells can influence hair follicles and the hair growth cycle. So what did they find and what did they study in their research labs in Taiwan? So what they were looking at was the topical application of monounsaturated fatty acids to mice that were bald. To the backs of mice, they applied the monounsaturated fatty acid solution for 20 days. And what they found is that there was a restoration of the hair in this area. Now, the mechanism of action is that the monounsaturated fatty acids, or the fatty acids, are absorbed into the tissue. It is then transported into the epithelial hair follicle stem cells by way of this CD36 transporter. This then triggers the PGC1 alpha molecule, and this then triggers mitochondrial bioregenesis. So what that means essentially, in very simplified terms, is that when you apply a fatty acid and it gets into the hair follicle stem cells, it can essentially trigger the mitochondria to become more active. And mitochondria is the energy cell. We have them throughout all of the cells in our body, and they generate energy via way of ATP. So if you increase the energy, if you can shift cellular metabolism in the hair follicle, well, then you can essentially promote that hair follicle to encourage more growth and encourage that hair follicle to go back into the anagen phase of the hair growth cycle. And this is what they've been able to show on mice. So it's a very encouraging finding, but we must temper our excitement with the fact that it is being shown on mice. Now, I have not seen many mice heading to Turkey on a Turkish airline flight to get transplants, So we can only make certain extrapolations. Now, it's not to say that the data is redundant, but even the medical director himself and the team have said this needs to be trialed on humans, of which they've got a patent with this particular solution and technology. So they're going to do further studies to see just how effective this is on human scalps. But the extrapolations in the hair loss space with respect to mice can be made to some degree. What have we seen that have been practiced on mice previously? Well, lots of things, but if you look at cellular metabolism with respect to hair follicles, so we saw this with the Hungarian doctor Andrei Mester in 1967 when he was trying to cure melanomas or surgically implanted tumors on mice using a laser. What happened is that when the custom-made laser wasn't powerful enough, rather than actually destroying cancerous cells, what it did is it actually triggered the hair follicles and it shifted the cellular metabolism to increase the output of mitochondria, and the mice actually started to grow hair. The laser actually started to trigger hair growth on the shaved backs of these mice. So that is what then led to the evolution of low-level laser light therapy for treating hair loss. So we can make some extrapolations from this data, but we just need to temper our excitement because we do need to see exactly how monounsaturated fatty acids have an impact on human follicles, not just mice follicles, but human follicles. And is it something that will lead to enough restoration for it to be cosmetically significant? To what degree will it produce hair? Will there be terminal hairs or just baby hairs? What happens when you use it in conjunction with other ingredients or other drugs? Is it going to be even better then? So there's lots of questions that we have, and there's also a safety factor as well. Anytime that we're using things that can influence stem cells, we want to know that it's not going to lead to aberrant growth. So it's a very exciting prospect, but we do just need to be a little bit cautious about how much we buy into it, particularly when you've got media throwing things at you. I mean, one article went absolutely bonkers and it got 19 million views in only a number of days. So we know that people are very, very excited about the prospect of solving hair loss overnight because we live in the Uber and Amazon delivery mindsets now, and we hope that things can be delivered, and we expect things to be delivered this evening, if not tomorrow. But this is something that, yes, it's exciting because it's delivered results in 20 days, but this is on mice. So we need to now see what happens on humans when they start to conduct these studies. Hope you've learned something from today. If this is something that you've read up on and you have some comments, please chuck them in the comment section. If you would like to see more of these videos, please subscribe. Do subscribe to the channel. And I hope to see you next week. Hope you have a good week. Look after yourself. Cheers.